finishing 1-1 at Stamford Bridge.
It's now time for The Way It Is. It's 13 minutes after 7. The 5th Annual Devolution Conference is set for the 23rd to the 27th of April at Kakamega High School in Kakamega County. This year's theme for the conference is Sustainable, Productive, Effective and Efficient Government for Results Delivery. Top on the agenda of the summit is health, seeking to achieve universal health care. And on The Way It Is this morning, I'm joined by Kenya National Commission for Human Rights Vice Chair George Morara to help appreciate the benefits of universal health care. Why has it remained a mirage in Kenya, and efforts being made to really realize it? Good morning, George Morara, and thank you for joining us this morning.
Thank you for having me, Michael.
Yes, now, we do know that the Devolution Conference is fast approaching, and universal health care is definitely one of the things that we'd like to realize as a country. It sounds good to the ear, but to the Kenyan, maybe it is far-fetched and a piped dream. First of all, let's start by your understanding of what is universal health care.
Well, Michael, I think from a human rights perspective, because that is where we come in really as the Kenya National Commission on Human Rights, universal healthcare means that all of us, especially in this country, have access to health when we need it, and it shouldn't be limited by our ability to pay. So really, in very basic terms, universal healthcare, if I may use one of the dictums that used to be used sometimes back, universal healthcare operates on the principle of from each according to his or her capacities or means, but to each according to his or her needs. So essentially, really, that is the bottom line.
Okay. Now, of course, for one to have universal health care, there are quite a number of things that come into play.
Absolutely.
There is the issue of affordability. We've got the issue of access, purely just how close is your hospital, how many doctors are there. There are quite a number of things that come into play. Looking at your experience, working with the Human Rights Commission, you probably are exposed to other countries that maybe are close to achieving that universal health care. On a scale of 1 to 10, where 10 is good health care, where are we, do you think?
Well, let me just, before I respond to that, on a scale of 1 to 10 where we are, just let the viewers know that when you talk about universal health care, countries have been given guidelines by the United Nations, especially the Committee on Economic, Social, Cultural Rights, under General Comment number 14. So the issues that we're talking about, those ones have been clearly set out under that General Comment, and they include issues to do with availability, issues to do with accessibility, issues to do with quality, and issues to do with affordability and all that. So those minimum core concepts have been clearly set out. In this continent, if you look at the what the African Union has given out there, they have given about 6 countries or so that have been able to attain another continental standard, because again, universal healthcare must be pegged to standards. The standards of what you've said, how many doctors per general population, the health facilities, the distance and all that. But one of the key standards that has been given out in terms of healthcare in this continent is under the Abuja Declaration, where countries were required to dedicate at least 15% of their national budget to healthcare. Now, if you use that standard in the continent, maybe only 2 countries have attained that, and this is South Africa and Rwanda. That is according to the World Health Organization. But if you look at the African Union, then that expands to about 6 countries. So on a scale of 1 to 10, even on resource allocation, we need to do a lot more as a country, because over a long period of time, our budgetary allocation has been hovering around not more than 5%, which really speaks to the deficit that we have in terms of funding our healthcare in this country.
All right, and from your opinion and your observation, how would the universal health care being achieved help us as a country in terms of mortality and basically just having a healthier nation?
Absolutely, Michael, because I think for me, one of the things I say that we need to do as a country is to invest more in what we call the transformative sectors in this country. And those transformative sectors, one of them absolutely is education, and another one is health. We also need to invest in the infrastructure in this country, ensure that we have adequate power supply, good connectivity in terms of the roads, because all these have an impact in terms of the quality of the services that, healthcare services that we deliver. And then also importantly, we will need to ensure that as a country, we, because healthy populations really, healthy Kenyans, mean more productive Kenyans. So there are certain parameters, what we call the vital statistics, that we should be looking at. We haven't done very well in that, especially we're still confronted by issues of high maternal mortality, despite the fact that we have a universal maternal care. Again, that maternal care has been bedeviled by a lot of challenges, one of them being that we don't have guidelines, especially on what it means to have universal maternal health care. Hence, we have cases of mothers still detained in our hospitals for non-payment of medical bills. We still have cases whereby a lot of Kenyans cannot access basic services. Michael, the statistics that have come out recently show that although this has improved significantly, because if you look at the period between 2009 and 2014, every year we had about 2 million Kenyans going into absolute poverty or falling below the poverty line because of the huge health burden, what they were spending out of pocket. The figures have come down slightly. Now we have every year about 1.5 million Kenyans going into absolute poverty because of out-of-pocket expenses. Falling sick should not be really either a death warrant or it shouldn't be a basis of rendering Kenyans destitute. So if we developed a comprehensive medical health insurance system, we will have cases whereby we don't have a whole number of Kenyans really being rendered destitute just because of spending the little amount of money that they have. And for me, the bottom line is that it makes economic sense to really have healthy populations. Let's invest in our people, healthy people, more productive people, and that is one of the parameters and markers of what a country that is actually on the trajectory to sound and sustainable development should be focusing on.
All right. Now, one of the things that, of course, would affect us positively is an investment in the health sector.
Yes.
And a huge one, because this would come at a cost. For there to be universal health for all and sundry, regardless of where you're living and whether you're working or not, would definitely cost the government a fair penny. Now, question here being, do we have the resources to do that? And if we do, where would they come from? If not, then how do we fill that gap? Because there's definitely a huge financial cost that is expected from the government for us to level out.
Well, let's look at what the reality is currently in terms of who pays for healthcare services. As it stands, currently 36% of the national of the healthcare budget is paid for by the national government. 32% of that budget is paid for by individual households. And that is what I was telling you about the high health burden, because if you look at the difference, 36% government, 32% individuals. And then 20% of the money that goes to financing healthcare comes from donors. And then we have about 2% that comes from what you're calling others, yeah? So for me, that is the configuration currently. But I think the creative ways of getting money to finance healthcare would be what other counties have started doing, especially counties like Makueni and Laikipia, where people contribute into a pool. And then that pool, you have a specific set of package in terms of the health delivery services that everybody is entitled to, a floor within which nobody can fall below. I heard Makueni, the governor Kibwana, has done very well. I think they're saying that each year they're going to be asking the households to contribute 500 shillings. And that's going to be very useful in terms of ensuring that everybody then gets to contribute into a common pool for universal healthcare coverage in Makueni County. 500 shillings is not a lot of money given the benefits that you're likely to reap out of that. Another best practice to borrow from would be what is happening in Laikipia, where Governor Ndiritu has worked very closely with the NHIF to ensure that there are more people who are taking the NHIF cover. And currently, I think we have about 6.1 million Kenyans who are on NHIF. And that is a significant increase from years gone by, about an 84% increase, which is very significant. So we need to get very creative in terms of going for low-cost investment from everybody, but then the dividends, the benefit should be such that once people pay into this pool of cover, then it assures everybody coverage across the board. So I don't think the burden has to be significantly left to the government, because as it were, Kenyans are already heavily paying for that. But then the problem is that it's not properly regulated, it's not put into a common pool. And if this money was properly regulated and put into a common pool, we would very easily be able to raise sufficient funds to ensure that everybody really gets universal health care coverage, so that we don't look at health as if it were a commodity to be purchased in the market. Let us look at health as a public good, and by contributing small amounts of money, like what Makueni is saying, 500 shillings, and even the NHIF cover, we will be able then to create a sufficient pool and ensure that we have a revolving fund that ensures that all Kenyans are adequately covered.
All right, it's now just about 25 minutes after 7. This is the way it is on Morning Express. We're going to take a short break. When we come back, we're looking at universal health, and we'll look at the devolved aspect of health and whether that is really helping you out wherever you are. Do let us know whether the fact that it has been devolved, you feel that impact and difference, and you can do that via the hashtag Morning Express KTN, or you can also tweet, and that's at KTN News, or you can tweet me directly. For now, we take that break. We'll be right back on The Way It Is.